If doctors strike, services continue. But when nurses strike, services do not.
There's such a big gap in identifying our responsibilities and even our voice being heard. Sometimes we're just seen as, I don't know, looking for the right assistant, so doctor assistant.
Yeah.
But for sure we are even meant to make decisions in the absence of doctors, because
nurses are the heartbeats of healthcare.
Yes.
Okay, so I'm a medical doctor, and I like to say doctors are like the pilots in the plane. They're flying the plane. However, the nurses, they're the engine.
I think we have boundaries, but doesn't mean that they're not learned, but I think we have more skill set compared to doctors.
We'll be talking about some of the challenges and myths that nurses face. And you find out what we mean when we say nurses. Hey, did I say nurses? Nurses have a lot of patience. Patience. Okay. We'll be back. Hello there. Now, Gregory Isaac said night nurse. The Animaniac said hello nurse. Are those terms disrespectful, or is it just ignorance? As we dive deeper into the world of the people who hold the healthcare system together. This is the MedSquad Podcast. My name is Yafesi Musoke, and I have with me the MedSquad, and they'll introduce themselves starting from my extreme right this time.
Okay. Thank you very much, Yafesi. I'm Anton Indiagwa, a general medical practitioner at Zuri Health.
Hi, my name is Bansi Murema, and I'm a nurse.
Hello, my name is Dr. Kelechi Okoro, also known as a health trainer, and I'm just a stakeholder in the health ecosystem.
Just a stakeholder. Wait, we'll get to whether it's just, but we want to find out. Just start. In fact, maybe we'll start with Bansi. Who counts as a nurse in Africa? You know, and how do their roles differ? Are there different kinds of nurses?
Yes, there are. There are different kinds of nurses. But first starts with a general nurse, and then most of us get to specialize into different branches. So yes, we're not just nurses, we are more than that.
So how is someone termed a nurse? Because we have traditional nurses.
Yes, you have to go to school, you have to get licensed by the government of Kenya.
And so the degree, you graduate as?
A nurse.
A nurse?
Yes.
Are there titles that go with that?
Yes, so we have different branches, I think even from a basic level.
Yeah.
Because we have Kenya registered nurses, we have Kenya community health registered nurses, we have Kenya psychiatric nurses, and we have Kenya midwives. I think Kenya midwifery nursing.
Yeah.
So those are the basic sub branches, and then moves through to a bachelor's level, who is a bachelor degree in nursing. Then all the way up to different sub branches.
Yeah.
But I think all of us start from that basic level and then move upwards to specialization, just like any other medical profession.
Okay. Daktari, please describe the interaction between doctors and nurses, like in general, but also what you prefer.
Okay, so the interaction between all health practitioners, that is including nurses and doctors and even other subspecialties, is one that I would describe as a coordinated one, that we need to work together for the betterment of the patient. For the nurses and the doctors, there are clear outlined roles and duties that you need to do. So nurses, they know their job, and doctors know their job. There will always be some issues now and then in any industry, and that is not to be, let's say, amplified. So the best thing to understand is that you work together for the betterment of the patient.
All right.
Yeah.
So are nurses clinical experts, or are they community educators? Or are they the PR of the hospital?
Okay, so if you ask me, nurses are the heartbeats of healthcare.
Yes.
Okay, so I'm a medical doctor, and I like to say doctors are like the pilots in the plane. They're flying the plane. However, the nurses, they're the engine. Okay, and then when you not mention PR, from what is obtainable right now, nurses are better PRs for healthcare, right? Because they are the ones who interface with the patient beyond just the consultation. What are your symptoms? No, the first person a patient comes in contact with likely is the nurse, whether it's an emergency, whether it's a regular consultation. So they play a pivotal role, because if you come to a house, the first person who talks to you in a house, an office, it basically sets the tone of how you will be treated, how you will feel, how you receive treatment. So you see how important nurses are, because if they do not, I want to use the right word because it's a very sensitive topic. If they do not interact and, set that tone for a successful consultation and, allay anxiety for the patient would have a wonderful time when they get to the doctor. So the nurses are very important. Heartbeats, like I said, and yes. And then you talked about them being educators. Nurses started health education way beyond it became a thing for medical doctors. Like I do health education now. Before, all we do is treat, consult, diagnose, and treat, right? But nurses have been unofficially educating, because when you come to the hospital, the first person, oh, you have to do this. Oh, how do you feel? They educate in the process before you get to, because of the educators, aside the professional service, because they're professionals, first of all, aside the professional clinical service that they offer, they are communicators and educators too.
All right. So, Bansi, do you feel that nurses get both the credit and the autonomy that they deserve, or that they hope they can have?
Slowly, it's coming, but we're not there yet. There's such a big gap in identifying our responsibilities and even our voice being heard. Sometimes we're just seen as, I don't know, looking for the right assistant, so doctor assistant.
Yeah.
But for sure, we are even meant to make decisions in the absence of doctors, because we're all trained to treat patients the same way. And even the diagnoses we make are not the same as the doctors make. And by the end of the day, they're meant to solve or rather treat the patient. So we are still yet to be there, but I think with time we are going to get there.
Does there come a clash sometimes where your diagnosis is different from the doctor's?
Not far apart. Our diagnoses don't even sound similar to theirs sometimes.
Yeah.
Because ours even is like a sentence. I'm supposed to make a diagnosis.
Yeah.
But then by the end of the day, the patient case goal oriented. So whatever I'll do for that patient, for example, if the patient is in pain and painkillers is what the doctor will give you, something I'll give. We're not moving apart. The goal is the same.
Is there a place where the skills that are required, because they're the general skills, and then they specializing? Would you recommend that nurses specialize, or are general skills good enough? And is that satisfactory to the doctors?
Actually, every unit, rather any other subdivision in a hospital, requires a nurse specialist. They're the ones who run. So if you go to an ICU, you'll find a critical care nurse. If you go to a newborn unit, you'll find a NICU nurse. If you go to theater, you'll find a perioperative nurse. All those things are different cadres and they're subspecialists, and they are much better and more enlightened in that specific area. So yes, it's important for people to get more specialized training and get to diversify the knowledge much better.
So, Dr. How much confidence is determined by either the qualifications or the behavior of the nurse that you work with?
So again, it boils down to the competence of the person.
Yeah.
You can have all the big names and all the qualification, but if you don't have the hands-on skills, and that is what I believe the most important thing in a nurse. You see, doctors will prescribe things, but for example, if it's a wound dressing, then it's the actual nurse who does it. So I think it boils down to the hands-on skills of the nurse, regardless of where they're specialized or they're still in general practice. So the behavior, that is an issue of interpersonal relationship between its person to person. It's very relative, and it is both ways. It's not just the nurses. It could be there is a toxic doctor who is causing the havoc other than thinking. So I believe, for me, I don't want to connote the nurses as people who are difficult to deal with. Or I think it's just an issue of interpersonal relationship, and everybody could have such kind of things.
Yes.
Yeah.
Now, because the nurses interact a lot with the patients, who are the people that this is the target. Do you see much in terms of training apart from the technical and medical skills, whether it's interpersonal skills or anything like that? Is that part of the career, or part of the?
Yeah, I think it's very important. That's one thing that nurses have more than doctors. Doctors, aside the personal decision to have a good interpersonal relationship with your patients, You know, it varies for doctors.
Yeah.
But for nurses, it's part of their job, if I'm right.
Yes.
They're taught how to relate with patients, how to, you know, interact with patients, how to communicate with patients. But as a doctor, sometimes we do not, you know, lay emphasis on that. Dr. Am I correct? We just want to treat our patients most of the time, and then that we know about the patient-doctor ratio.
Yeah.
We don't have time.
Yeah.
For where I come from, doctor-patient ratio is 1 to 10,000 patients. So it's not like the doctor doesn't have interpersonal skills, right? They just don't have, yes, there are just too many patients to deal with. But for the nurse, it's a very, very vital trait that they possess and they constantly try to improve on. So yes, very, very, very important. Yes.
So
apart from the experience, apart from the skill,
yeah.
that's very important, especially for patient care.
Okay. Now, when we come back, we'll be talking about some of the challenges and myths that nurses face. And you find out what we mean when we say nurses. Hey, did I say nurses? Nurses have a lot of patience. Patience. Okay. We'll be back. Hey there. Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the MedSquad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury, it's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the MedSquad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the MedSquad Podcast. We're looking at the role of nurses in healthcare in Africa, and they hold it together. They're actually the heartbeat. But what are for Bansi, what are the biggest misunderstandings or challenges that you face as a nurse?
Sometimes we're not trusted by the patients. They're like, the doctor has not said, and you clearly know what you need to do for the patient. And we even sometimes in some setups look like assistant doctors.
Yeah.
Like I think in private hospitals, they've even tied that you don't have a right to make a medical decision unless the doctor is there.
Okay.
So I think our first one before, when my nephew was convulsing, and it was among the best hospitals in the country, but they couldn't do anything until they found a pediatrician.
Yeah.
Can you imagine even the nurse giving the basic emergency drug and waiting for the pediatrician to come and prescribe? It is so bad. But I know in some setups, they actually allow even nurses to make that decision and give emergency medicine. So yes, we're not assistant doctors. I think that's the most that goes around even that time.
Yeah. And this trust is mainly from patients who have that perception
Yes.
of the title doctor and all. So
please, can I say something?
Yeah.
Sometimes the problem is not just from the patient. Sometimes it comes from the nurses themselves, and sometimes it comes from the doctors. For example, where I was working one time, because of the dichotomy in the health ecosystem, you know, the doctors are working separately, the nurses are working separately. Over time, the nurses now just relax and they say, oh, the doctor says that they are the ones who should do the treatment, so I will just wait. It's not like they've been asked not to do anything, but because over time they've gotten into trouble for doing that, or they are not trusted, or they feel they are not trusted, they don't fold their hands. They just wait for the doctor so that they will not be blamed. Like when I was doing my internship, there's some nurses I would trust with my patients, right? And then I remember when I was doing my obstetrics posting, 1G posting, the people who taught me how to, check for cervical dilate. Of course I know the theory, right? But my consultant is not going to come down to my level to come and start teaching me those things. But I put my trust in the nurses the midwives, who has done this for 25 years. I've just been a doctor for 1 year,
Yeah.
So my theory knowledge would not even match with someone who's done this for 25 years. And also when I was in the assistant and emergency posting, there was a very bulky, a very huge male nurse. He was very good with trauma. When there's a mass, there's an accident, we have a lot of trauma cases.
Yeah.
Look at how tiny I am. Okay, but this man was so huge and he was very good with trauma cases. I learned looking at him doing the things he was doing. I know the theory, but as an intern, there's somebody I could look up to, and I'm very proud to say I had a lot of nurses to look up to.
That's another thing that comes in. Is there sort of a stigma that when someone sees a male nurse, do they look at them as, this is a doctor in training, but for now? Yeah. Is there?
I think it's two-way, because most of the time you find we even call female doctors sister. So we'll actually call the female doctors nurses.
Nurses, yes.
Everyone can do that. But I feel when you're talking about the how you got to learn, when you're doing when in school we have job descriptions. So for nurses we have more skill set compared to doctors, and that's why even when you enter an ICU, the doctor will only write the notes, but every other thing, including the emergency care of that patient, will be handled by a critical care nurse. So all those things, I think we have boundaries, but doesn't mean that they're not learned, but I think we have more skill set compared to doctors.
So let's rephrase that. You have more skill set in some areas compared to doctors. You can say you have more skill set when it comes to a surgery, right?
Yeah.
Right. And then also,
surgeons.
yeah, exactly. And then I would say something about nurses, the skill set they have. They tend to notice things faster than doctors. I give that to you. Sudden fever, change in vitals, because you took the vitals, you do your recording and all of that. So I just think that, dichotomy and all the
ratios also.
It's not really necessary. Everybody has their skill sets. Everybody has, their job description, and then the patient is the goal, really. So if we stick to our boundaries and specialties and limits, we will do a very good job without arguing and without making the other person feel, higher than the other or lower than the other.
They're facey.
Yes.
Even
Okay.
Yes.
So for me, the issues of trust first. I will not even trust an incompetent doctor. So for me, it is not an issue of are you a nurse, a doctor. It is, are you competent with what you do? If you are a nurse, then we know what a nurse should do. Are you a competent nurse? As a doctor, I trust you because you're doing your job as I do mine. Okay. Again, even nurses, they will tell you that doctor will not see even me. They cannot even resuscitate me.
Yes.
Okay. So it is both ways. So it's a matter of competence and professionalism in terms of the relationship. For me, I believe that if doctors strike, services continue. But when nurses strike, services do not. It's as simple as that.
Okay, that's a deep one. Which now brings me to a pretty critical issue when it comes to nurses. So you may look around you, the work environment, the pay structure, and then see opportunities in other countries. We've heard so much about how other continents are offering all sorts of packages for nurses. Is there a challenge of brain drain in the nursing area?
for sure there is, but then there's also brain gain. You go there and get trained on things that are not in the country. Like I think the first time people ever trained for oncology was actually not done in Kenya, but now it's actually been done. But the first nurses who trained had to do it from a different country. So yes, there's brain drain. For sure, the country doesn't pay us enough compared to other countries. But however, we can look at both sides. We go there and learn different things and come back and use the same skills in the country.
For those who come back.
For those who come back.
Can you go there for school?
But please come back. My company is called Jakpa and Jakpada. When you Jakpa, please Jakpada with your skills. Yes.
Okay. So when pushing for more autonomy or independence a bit, does it threaten the teamwork? Because here you have good accommodative doctors here but is there a fear of rocking the boat, so to speak?
I think apart from, even before we talk about autonomy, our biggest crisis is there's very few medical professions. So you actually find the teamwork has to be there, whether you like it or not. The doctor will be there versus many other patients. I'll be there with so many other patients with probably more work. So as we're fighting for all those things, I think other things we need to advocate for is for more healthcare practitioners, because there are things that we don't do, there are things that doctors shouldn't do, and they're forced to do because, well, the setup doesn't accommodate so much stuff in terms of different medical expertise.
So is it numbers? Is it a numbers thing?
Yes, it is a numbers thing.
So do we focus on training more nurses or supporting the ones we already have?
I think hiring more nurses or hiring more doctors, the training. Of course, I think the higher you go, the
narrower.
narrower it becomes. Of course, training a doctor or training a health practitioner requires even a different kind of grade, even at that basic level of education. So you need to, yes, in as much as we're trying to support or train or whatever, I think we need to, at the point where they even graduate, I think they should be exposed faster than they are staying for quite a long time waiting for even internship opportunities.
So I think the both of them can go on concurrently while we're trying to, of course, employ more nurses and more health professionals. We're talking about nurses here. We should retrain the ones who are here. Because I don't know about Kenya, but where I come from, I'm sure we're still using the same educational curriculum from 200 years ago. Okay, so there's a need to go as far back as, the system, the school system, the university system. Okay, let's start including some of these. Let's just rejig the curriculum and include some of these new trends in healthcare, especially when it comes to AI. We see what AI is doing in the industry. Some people are scared that humans are going to lose their jobs to AI, right, or to technology. But I say no. You have to move with the trend, okay? Being a healthcare professional that is well knowledgeable and skilled in AI will help you to even keep your job and get more jobs. So the people who are going to be knocked out of the chess table are those who are not playing right.
Yes.
Okay, so let's, retraining, like I said, the curriculum, and I'm sure we can do better. Yeah.
Our curriculum, as you know,
Ours has evolved a bit.
it's having a few issues. Yeah. So do you feel in some way there might be a compromise in the quality of
the training
that's coming up? Because
with the new education system,
with
the new education system from the elementary level.
Yes.
So for me is, even when you're writing a CV, does your primary school really matter when you have done your university? You see, there is academic and then there's professional. Okay. So for me, the competence-based curriculum we have, it has its own good and the cost and all those things. But for me, it is the level of training at the professional level. I am a strong advocate for more skills than just theory. I think the nursing school in Kenya is, I think, one of the best. And that's why we see them running away from our country, because they are needed elsewhere, which they're very competent in different disciplines, as opposed to others who are just like one-dimensional. So I think it's a good thing. There is a question you asked earlier about the autonomy the nurses should have and all that. For me, nursing is one of the oldest profession. It still has its place in the society. There's no getting away, or you have to respect them and pay them enough. I think nurses are overworked. If, for example, when I was in internship, just walk in, see the 10 patients and go. I will update all the files in an hour, and everybody has a medication to be given, and the lines are not put, and so many things. And that person will be there watching each and every patient and documenting each and every patient. If you want to see the real notes, then you look at the cardex. But doctors, they just write something you can't even read.
Yeah, doctors.
And you go. So we cannot, we will. So I think nurses are the core, and we cannot run away from that.
I'd like to add something else. Nurses seem to be doing, apart from the doctors, nurses are doing the rest of the job. So I think we should start thinking about training and including other, like nursing assistants, There are so many other specialties, this is called specialties or professions that can support the work that the nurses do so that they can do their core job. Some nurses are doing the jobs of cleaners. Some nurses are doing the jobs of nursing assistants. Some nurses are doing the jobs of, so many things that could have been taken care of. Some nurses are doing the job of care workers, social workers in the same hospital. Meanwhile, in other developed worlds, we have all of those professions clearly outlined. They are trained for that. And then the nurses can just focus on their job. So I think that's something else that will help other support professionals that can relieve the nurses of the job that they have to take on. Even some doctors. So if you give the nurses too many jobs, they take on too many jobs. The doctors also have to take on too many jobs. And who suffers? The patient.
Yeah. Hey.
So Fesi, just on the same point, I just on a different trajectory, I think nursing, even everybody knows that even before you go to nursing school, it's something you have to be passionate about. So, for example, if you have so many subspecialties and so many other people coming, they dilute the actual essence of being a nurse and who you are as a person. If you look at the role of nurses, it's not like doctors. You can just be a doctor and have that term. But a nurse does not even have is a nurse. So the empathy, the passion, even from the founders of nursing as a profession, it's something very noble. So I think for us not to dilute the actual profession and what it is and it has grown to be, let us reduce the burnout by increasing more nurses, giving them more support, and let's say have better remuneration for them.
Please, I'd like to counter what he said again. Because we like to glorify suffering in Africa. Just because you're a nurse and it's your calling, it doesn't mean you should suffer for it. Okay? So let's not glorify suffering.
Yeah, I'm saying in terms of burnout, that is where they have...
saying that he has a calling, is going to dilute their role. Let them have less to do and pay them more money. Don't put so much job on them. Sorry, I'm just being the devil's advocate. No, not the devil's advocate. But I mean, he has a point with them.
He was saying that you were trying to reduce the burnout.
Yeah.
So increase the number of nurses, pay them well.
Yeah.
Yeah. So before this fight continues, we're on the MedSquad podcast. And when we come back, we'll be actually looking at innovations that could actually help the nurses to avoid that burnout. Stick around. Welcome back. It's the MedSquad podcast. You're with me, your Fesi. We have Dr. Kelechi here. We have Bansi here. We have Dr. Anthony. And we are talking about the role of nurses. As the doctors are fighting and hogging the spotlight, let them fight. For you, Bansi, what is changing for nurses in terms of innovation? Do you see anything that is making either life or the environment, the work environment, easier for you?
Yes.
This hope?
Yes, there is. The changes start from the training. Right now, we are not even using patients as mannequins. We have now proper simulations that can assist. We have even virtual reality coming into place when it comes to training.
Yeah.
We have we have digitalized how we deliver our services, and like how we were doing it a long time ago, where you had to go to hospital to be even given your results. So these days we're able to relay that information differently.
Yeah, so it's medicine.
Yes, that's telemedicine.
That's
Okay, yes, telemedicine.
Yes.
Yes. Then you have, I think now even AI has come to place where by the time even that patient is coming to you, even the symptoms can be filtered out without, there's a new filter. By the time you're getting to see that patient, then the diagnosis has already been done and you're able to give the care more concentrated because you already have been narrowed out to the easiest diagnosis that person can be in here.
Okay. So as nurses, with the current environment, is the focus on direct care or research, innovation, training? How is the balance?
Both. I think they're nurse researchers who have actually do that. They're nurse educators who specifically teach. They're nurse who are on the bedside who typically stay with patients from the clock. So different lines, all of us are in the same goals, just to make sure the patient's care is met.
Okay. And the bulk of impact, is it felt in rural or village clinics, community hospitals, or in the big city?
So medicine intervention is multifaceted. You know, it's the solutions. They're not just trying to solve one problem. So yes, the nurses are doing a lot of work. Their impact is really felt in the communities, you know, in the rural areas where you do not have enough doctors. You know, they're doing the role of community health worker. They're doing the role of, you know, first doctor on call most of the time. Sometimes it's the nurses you're going to meet before you go and call the doctor from. Maybe you're in one village in somewhere in Mombasa, or it's not a village. But you know,
village is there.
Exactly. Yeah. Before you get to town to call the doctor, there's most likely a nurse there. So they're doing a lot. They're doing a lot of work there. But the nurses are also doing a lot of work in innovation. Like she said, nurses should be more. Everybody, every specialty, every profession should do more. Okay, we need more nurses, nurse innovators. We need more nurses. I mean, there are a lot of nurses who are even, you know, floating NGOs. Before, it used to be doctors who have NGOs. It used to be, you know, non-medics who have NGOs. Nurses have NGOs. They have the right to, you know, they have community initiatives. They're going into tech. They're going into oncology specialists. Yeah, so there's impact everywhere. But the most important thing is wherever a nurse finds themselves, they should make the greatest impact. Yes, that's how I see it.
Now, we want to hire more nurses. Do we have places for them to work?
Yes, that is a no-brainer. We're still saying that we need, just like teachers, we always need nurses. Because one of the challenges they face is burnout. Why? Because there are few nurses compared to patients. The ratio is outrageous.
There are also, however, technology-wise or equipment.
You see, technology is not there to replace people, especially in medicine. It does not come to replace clinical acumen. It is a support. Okay? So, however, think of, for example, public health initiative in Kenya, cervical cancer, breast cancer, maternal health. It is driven by nurses. So, and how many women still need screening today? Have you ever seen, asking a woman, they tell you that I was screened for cervical cancer by probably a nurse. And you see, we cannot, I'm still telling you, nursing is the backbone of any health system in the world. And that's not negotiable.
So now, we'll come back and talk about the future and advocacy when it comes to nursing on the MedSquad Podcast. Welcome back. This is the MedSquad Podcast. I am the squad. This is the Med. My name is Yafasi, and I have Dr. Kelechi with me. I have Vancy and Dr. Anthony as we talk about now I'm talking about the future of nursing. So I have $1 billion. Not for real. So don't. Yeah, don't even. Doctor's not included. So I have $1 billion and I give it to you. What's the first place what's the first thing you're going to try and either change or impact or grow or influence? Nursing.
I think I learned to develop the healthcare at the rural setup. I think the moment we filter out that from level 1 kind of care and level 2, then that sorts so much so that by the time the patient gets to a level 6 facility, a lot more has been done. And maybe only the reason of referral is being handled at that level. So by the time the patient is coming into that facility, even the radiological tests have been done at a level 5 and at a level 4. So the filter keeps getting lower because now most things are being handled even from the grassroots level. So I think that's what I'll do if I got $1 billion to sort the healthcare.
Well, you'd have some change left over.
Yes.
Which now these two want to jump on.
Okay, so I would jump on training. Okay, training, especially in tech, AI, especially in improving their skills. Okay, so that they can support the work that has already been done. For example, if nurses should be able to do cervical pap smears.
We do.
Very. That's what's working. Your money is working.
Okay. Yeah. So I think we're talking about Nigeria. We're talking about Kenya specifically, right? So nurses should be empowered, right, and trained in such skills that you don't have to wait for the consultants or the doctors to come do them. So training, retraining, upgrading their training, and then give nurses the wings to fly. Okay, the way we support doctors training, residency, and all of that. There's a lot of times where we're all clamoring for recognition, we're clamoring for respect, and the patient is dying. I don't care about all of those things. I don't care about ego. We shouldn't care about all those things. The patient is dying. So we should, if I had such money, I'll put it into training, retraining, and just upgrading skills. And then I wouldn't put policy is also very important, because no matter what you do and there are no policies to support what you are doing, then there's no government buy-in and all of that, then I think we're just wasting our time. We could achieve some things, but if the government is not involved in the process, then it's going to be a problem. And then I've just used some of the money and then buy some nurses, some cars, they're underpaid, they're underworked, they're underrespected, they're undervalued. Okay? Yeah. We need it to nurses' welfare. Yes. Very important. If a doctor is looking good, if a doctor's life seems, comfortable, a lot of people say, oh, you're a doctor, you can never suffer. We should say the same thing for nurses.
Yes.
Because they're saving lives too.
Yes. Hey, this is good stewardship.
So, from the Kenyan settings, I don't think we have a deficiency in skills for the Kenyan. I think it's an issue of scope. And the patient is convulsing. The nurse has been giving medication for the last 20. They know which one. Yeah. But they have to wait for that lazy doctor to come. So it's not an issue of skill. So I think we should have a review of the scope in terms of what they can do, what they cannot do, because I don't think we have a training issue. So for me, it's more, employ more and pay them better because of the burnout. The quality of service goes down with how you're overworked and underpaid. So motivate them with that. And I like the aspect of nursing welfare. That would be.
All right. So for this final word, I'll just leave it to Bansi. Say the last word as we actually remember to thank a nurse. Yeah. So what would you like to say?
In conclusion,
thank you.
All right. Just like Dr. Anthony said, we are the backbone. No lies. We are not. If you're not at work, then the healthcare doesn't go on. Yeah. I think there's a time when it was years back and the nurses on strike. It was even a national crisis. The doctor would be like, it's okay, I've actually taken the medication, but will you give yourself? No, the doctor will not even give it to you, because now that time when there are strikes, it's very overwhelming, because probably you have patients in hundreds to come to see you. So we just to every other nurse, just like me, go to school, train more, upgrade yourself, be someone different. Just like the way doctors go and do residency and the specialists and specialize in things they like, also do that for yourself. There's more to just being a basic nurse.
All right. And on that, there's more to being a basic nurse. There's a lot more. You've had everything. So what you can do also is share this episode with someone. First of all, it could be a nurse friend of yours. Encourage them that we actually see you. And we're grateful for you, because we know nurses are the backbone, not just of African healthcare, but global healthcare. You can follow us on all our socials at the MedSquad Pod. And we'll see you next time after your encounter with the nurse.